right, let's go through a user interface design lightning course. Very first, if you have a tablet, you want to set it up so that you have two workspaces, one on the left, one on the right. You can do the same on your desktop, and actually on the desktop, you can increase it to 3 workspaces or 4 workspaces. Key thing to realize is you can use the same workspace on your mobile, and the way you get 2 workspaces on mobile is you take the second workspace and you overlay it on top of the other one. So you have a slider which you pull up. The key thing here to realize is that each of the workspaces on mobile, tablet, and desktop are approximately the same shape. Why is this important? Because then we can develop modular components which are the same size that you use across all platforms. Very interoperable. The other key thing is you want to be able to multitask. You want to be able to take your chart, your notes, your medications, the static information on one side, and view this concurrently with the ability to write orders, tests, and new medications on the other side. You can use this split screen device and full screen on either side if you like, or both together. Now the question is, how do you group all the clinical data which you're viewing on the chart on the left? Well, there's at least 6 different ways you can view it, but the key thing to realize is you only want to make one user interface. So the way we do it is we take all your notes, medications, labs, and imaging, and we put it across the top of the UX, and then we take your actual issue, the patient's being seen for HIV, diabetes, or hypertension, and we add this as a filter. Right now we're filtering to view everything, but you can filter to just sort by HIV, and now we've configured your entire chart to an HIV-specific chart. You can easily go and switch this to diabetes, and now we have a diabetes-specific chart. Of course, you can also think that this is an auto-configuring user interface. You're able to generate any user interface you desire on the fly, and this is the most important concept not done in medical records today. This idea of data encapsulation, where you create a capsule called COPD, and you put all the care team medications, tests, imaging, and all the inpatient, outpatient notes into the same spot related to that issue, is, I think, the most efficient way to display this information. Now, we haven't talked about the timeline and the summary. The timeline is my favorite feature. Why? Because it tells the patient's story. You're able to see all the information in the patient chart in the order it occurred. Of course, you can filter your timeline by the issue, by diabetes or hypertension if you just want to see that issue. And you can pull the timeline down if you want to see the upcoming appointments, upcoming tests, and lab results which yet haven't been reported. Now, if you're looking at a particular object in the user interface, such as this medication order, you see at the bottom of the screen something called a mini timeline. The mini timeline shows you the items which happened before and after that medication order was placed, so you can read the exact note which this medication relates to and know exactly your context of where you are in the chart at all times, like a paper record. Now, we want to build a very modular design, so imagine that these panels each have different layers, primary, secondary, tertiary. You can build a modular pattern for medication panels, which go through a similar panel. You can do the same for labs. You can do all the rest with the rest of your user interface. Looks beautiful. This here is Edward Tuffy-inspired Spark lines. You have over 450 data points from a week worth of data, visualized in a very small visualization that's easy to read. You can do the same for a week's worth of vitals. Now, the key thing to realize is that modularity needs to be customizable, so the user can change how they view and how they sort and group any of these panels based on their personal preferences, but we still have modular components. You can use these components if you have a huge screen. If you have 2 huge screens, you can still use all these components. They're tiling across your 227-inch monitors, and you can also do the exact same record on your mobile phone if you want. You just build one record. You don't need to build 1,000 records. Now, up here we have something I call a sandbox, where you're able to display any type of longitudinal data with each other. Therefore, the clinician can really go in and figure out what's going on with the issue and get to the bottom of it. Now, we haven't talked about the most important part, the action panel. The action panel is the right side. This is going to be different at every implementing partner and at every clinic. They all want to do something different. They all have different workflows. They all want to develop different workspaces for different users. Therefore, the action panel is entirely customizable depending on the implementation. In this case, the patient's coming in for a clinic visit. They're going to be seen for HIV, for diabetes, and for hypertension. You have to realize these are each separate workflows. And the way we handle it is we take your 3 separate workflows, we merge them together into a patient custom workflow, and then we distribute that patient's custom workflow based on who's in the clinic that day. So we have essentially real-time dynamic task shifting based on what the patient is being seen for in that particular clinical encounter. And you have to realize that when you're entering a physical exam into this part of the action workspace, it updates the clinic part to actually show you the old physical exam. So these 2 halves are always in dynamic relationship to each other. So we need to talk about workspaces. You know, if you want to go in, you can rearrange these components however you want. It's completely customizable. These are, you can just set a few parameters. You don't have to recode this at all. It's drag and drop modular design. It works on all devices. It's built for multitasking. It's intuitive layout, self-generating UX, powerful data tools, custom workspaces. It works off by here and here. It's 100% panel. And if you're interested in modules, are all available on this website.
I'd just like to point out that is exactly 5 minutes. I mean, not 5 minutes, not 4 minutes and 59 seconds.
By the way, that's Greg Schmidt.